New tonight, it is standing room only tonight for a vote related to a controversial behavioral health hospital in Webster Groves. KVC Missouri and St. Louis Children's have teamed up to try to open the facility in the middle of a residential neighborhood. But first, the city has to rezone the land, and Fox Files investigator Chad Mira was at the city's Planning Commission meeting and has more on that vote tonight. Chad?
And that meeting's still going on behind me. That room packed with people waiting their turn to speak right now. You know, this time of year, you're used to seeing the competing campaign signs in people's yards. But in this North Webster neighborhood, it's not Trump or Harris that the signs are. It's all about this behavioral health hospital. People who live there have put up signs. They've circulated petitions against it. KVC Missouri St. Louis Children's Hospital are sending out mailers and doing new studies to try to address some people's concerns. Both sides of the issue are inside City Hall right now. A packed room at a Webster Groves Plan Commission meeting as the city considers a new behavioral health hospital.
1 in 6 children experience a severe mental health disorder at some point in their lives.
Michael Garcia lives directly across the street from the proposed location.
We are very adamant that this is not the right place to build a hospital of that magnitude.
The hospital, proposed by KVC and St. Louis Children's Hospital, would be put here, surrounded by homes in Garcia's Webster Groves neighborhood. Right now, right across from the Garcias is just the day school out here for children with behavioral issues. There's that and some office space around as well. Enrollment's about 90 kids, but if this proposal goes through, enrollment goes up. There's the new hospital and its staff, as well as a new outpatient center, potentially bringing a lot of new people to the area. Monday night, the Plan Commission considered a new traffic study for the area. It says the new hospital would have 77 inpatient beds and 196 staff members. The outpatient center could serve up to 48 children per day, and enrollment at the current school could go up from 90 to 130 students. The traffic study says this will have a minimal impact during peak hours.
It adds capacity for care and does so in a calm community environment.
Garcia and others have safety concerns other than traffic, though. Webster Groves police have been called to this location more than 80 times over the last 2 years.
It's just the nature of the business. You know, they're doing great work, but it has inherent risks. In
a previous statement, Children's and KVC said suicide's the second leading cause of death for 10 to 14-year-olds in Missouri. And the area has fewer than half of the behavioral health beds needed for our children. KVC and Children's have made some updates to its safety plan. Police and Fire will now get the facility's safety training manual. It creates quarterly meetings with Police and Fire, and medically stable patients will be transferred with private ambulances through a secured entrance.
We as a broader St. Louis community must instead prioritize the untapped potential and the necessity for care to those who need it the most, and not be dissuaded by past negative experiences or hypothetical future concerns.
With Monday's vote, Garcia says he's not letting up.
And so this is just the first step.
So many people asking tonight, why does it have to be this location in the residential neighborhood? Just as I was stepping outside to give this report, a representative from the proposal went up and said it's because it's in a neighborhood that this is such a great spot. He says children really thrive in therapeutic care when they feel connected to a community like this location would provide. Now, a vote hasn't happened yet on whether or not the Plan Commission will recommend the rezoning, but whether or not they do, the City Council will still have the final say in the future. For the Fox Files, I'm Chad Mira.